Depression can occur in the elderly, but it's not a normal part of aging. While everybody experiences periods of sadness from time to time, depression and other mental health issues are treatable. I'm Dr. Ryan Poling with Veridian Behavioral Health.
Dr. Poling, thank you very much for being on the show. I guess let's talk about as we age and how depression comes involved. How is it different as you age than maybe when you had depression as a younger person?
Well, oftentimes younger people experience more the emotional parts of depression, the sad mood, the loss of enjoyment of everyday things. That can still happen in older people, but older people often experience more things like cognitive issues. They'll find their memories are slipping, or they're not able to remember things they would expect to remember. They may also have some bodily symptoms. They may experience, stomach aches, general pains, joint issues, all those sorts of things, which can make it difficult because some of those things also naturally come with aging.
Are you finding it maybe that older patients are more likely to come in to seek help nowadays in society than maybe they once were?
Sure. Oh, yeah. In fact, the research suggests that about 1 to 5% of elderly people have depression. Okay. And so, people from my generation are generally more willing to seek out help, but people from, the boomers, from the greatest generation, they're oftentimes less likely to seek help because they go into life with a pull yourself up by your own bootstraps mentality, especially here in the Midwest. Fortunately, that does seem to be changing. It does seem like older people are more willing to seek help than before.
We're going to switch and kind of talk about maybe those patients that are already dealing with a medical issue of dementia or Alzheimer's. And I think there's probably a depression component to that as well, isn't there?
So oftentimes people who experience one of the dementias can have depression. Understandably, if they're aware of their memory difficulties fading, they're going to experience some mood issues with that. And even if they're not, sometimes the depression can still become a part of that. And so fortunately, that is quite treatable. One of the most common treatments is something called reminiscence therapy. And typically that involves all 5 senses, bringing those in and allowing a person to remember events from their past, watching old movies, photographs, cooking dishes they used to love, listening to favorite music. Oftentimes that can bring back a lot of positive feelings for individuals who are experiencing dementia and depression.
I think one aspect as we get older is maybe the caregiver spot of it, where you have 2 spouses, maybe one of them is dealing with more medical issues. I think there's a mental health aspect that goes with that as well. Why don't you talk about that?
It can be an extremely stressful situation. You're responsible long term for the care of a parent, a loved one. That can be draining. As much as you love that person, it can also be very difficult to provide that level of care for what's oftentimes a long chronic illness. So it's important to help the helpers. It's important that caregivers also get support as well.
Thanks for watching The Pulse. For more information about services at Veridian Behavioral Health, visit veridianbh.com.